And one of the, it's really wonderful to be back in Thailand. We really enjoy the peacefulness here and the love of the Thai people and the dedication of folks that want to help the Thais. And one quote that will run through everything that I have to say today is perfect health depends on perfect circulation. You all know that, but it's really important that we do everything we can to keep that blood flowing. And there's so many different aspects to it. Exercise, breathing, muscle spasms prevent oxygen from flowing through the muscles properly. If you look at my hand when I'm opening it, it's white, and then it turns red. That's the way a muscle spasm is. It's tight and it doesn't allow the blood to flow. There's perfect posture. There's so many things that help us with circulation. One thing that's fascinating to me that I ran across just the other day in God's Healing Way. This is by Marianne McNeilis. On page 24, there's a really neat quote that says, I'm sorry, it's 42. Flip those numbers around. I guess I am dyslexic. Says the pleasure of doing good to others. Anybody remember this quote? The pleasure of doing good to others imparts a glow to the feelings which flashes through the nerves, quickens the circulation of the blood, and induces mental and physical health. Amen. Testimonies, volume 4, and it's page 56. Amazing that it can help our mental health by helping other people. Helps your circulation, helps your nerves. Amazing. But this time of the world's history, everybody needs their nerves calmed. They need to have their physical and mental health induced. I just want to give you a couple examples. One, years ago, I was at Weimar Institute, and this was an amazing thing. I'm going to talk about headaches later, but right now is a good time to interject this because there was a lady who was a doctor's wife, had a severe headache for about 2 or 3 months. She came to the center to try and get over that. We did everything we could to try and fix her headache. We did hot foot baths, we did neck massage, we did neck traction, we did exercise. We tried. She didn't really feel like exercising much, but we tried to do as much as we could. Then we looked up in Ellen White's index to see what we hadn't done yet. There was only one thing we hadn't done, and that was to go out of doors and sing praises to God under the trees. And I said, now that's pretty radical. That's an interesting one. So Sabbath afternoon, we dragged a piano outside. We got a bunch of the students and staff together, and we started singing hymns. In 10 minutes, this lady called me over. Byron, come here. I said, what's up? She said, my headache just went away.
Praise God.
Singing hymns of praise to God.
She was singing too?
She was singing too, oh yeah. We all had hymnals, and we were all singing praises to God under the big tall pine trees in the shade, and she was just so excited that her headache just, boom, disappeared. Things like that happen, and from relief inside. A lot of times people have a lot of guilt inside. They need to ask forgiveness of other situations, people, and if you do that, then you're relieved internally, and it relieves it, and it promotes your circulation. It relieves your nerves, and you start getting healing. And it's not magic. It's supernatural, and it's designed by God to interplay with our minds and our bodies. Yes?
Who would have thought that inflammation could be caused from a conscience that's violated?
Yes, that's right. We had one of our doctor's mother-in-law had rheumatoid arthritis. She was just crippled up. And we did everything we could to help her with a natural diet and everything. Turned out that a year or two later, she went back home to her place in Puerto Rico, and she had listened to her daughter had listened to some seminars on forgiveness. And so her daughter telephoned her and said, is there anything that maybe you and Daddy have against each other? Is there something that's you're harboring in your heart that you have not asked forgiveness for? She said, yeah. I kind of take the dominant role here at home. He's not a Christian, and I am, and I just I'm over him all the time. And she said, I need to apologize for that. So for about an hour, she asked his forgiveness, and she talked to him, and he forgave her, and they were restored. And she said, prior to that, she could walk maybe 100 feet, but be in pain with that. She started walking 500 feet, 800 feet, around the block, and her neighbors started noticing. She said, we haven't seen you out walking in 3 or 4 years. What's up? She said, I forgave my husband for some situation, things are restored, and all of a sudden, my joints started moving better. And now my pain's gone in my extremities. She had already done all the other natural remedies, but she hadn't touched the heart. So just fascinating how spiritual things inside of us just refresh our whole system so that everything works properly. Yes, Mike?
This just came to my mind as you were sharing the quote that says, the pleasure of doing good to others.
Yeah.
I mean, I was thinking, what is that? Because it has to be God's love, right?
Yes.
Because love does good and nothing but good. So it has to be that pleasure of doing good is a showing of God's love coming through. It only does good.
Yeah.
And it results in joy.
That's really amazing.
Maxine?
Can I share? Don't worry, do you need me to come to the screen? Okay.
And I'll get close so you can,
Okay.
it's close enough?
So, my schedule this semester is really crazy. Well, it's not, but because I teach on Mondays and Fridays, I have to prepare on Sunday because during the week I'm interrupted so many times. 2 minutes, the door's knocking. As soon as that person leaves, someone else comes in. And so Sunday has been a work day for me of sorts. But this week, I got my new massage table, so I thought, let me inaugurate my massage table. So on Saturday afternoon, Mrs. Foster from Ames called me. She had a student in her house who was having problems with insomnia and everything. And so I said, come over tonight. So I did massage and steam bath for her. And then on Sunday afternoon, one of the girls who was having a difficult recovery from a cold, I gave her fomentation for her lungs. And I just felt so good. I worked on Sunday, but I still feel good. It's just a really, really nice feeling for just doing for others. And I kept on thinking, how come I feel like so on top of the world? Now I know. I should have known that, but now I know.
Very good. Thanks for that testimony. All right. So, back again at Weimar, the very first patient that we ever had, we had a small group of 9 patients came, our very first group, but one man arrived early. His name is Bill Barkley. He's passed away now, but he's a pastor. He wrote a book called the Irish Soldier. As he became a Christian, he was in the Irish Army. A big tattoo of an eagle on his chest when he was drunk one time. He's just an amazing fellow, but he had total transformation. This guy was just one of God's special pastors. But he ended up getting heart disease. He had to have open heart surgery, a bypass surgery, and then about 6-7 years later, his blood vessels closed up again. And the doctor said, there's really no hope, we can't do it again. He was 78 years old, and they said, you'll probably die within about 3 months. He said, well, I've heard about this new program that's starting up at Weimar. It's a brand new place. This was the very first patient group. They drove up early, arrived Friday afternoon, and we were just headed out for a weekend our last free weekend without patients, and he arrived. So one of the staff stayed by. He was so severe with his angina that within 10 feet he would double over from chest pain. I mean, that's really severe, and that's with taking medicine, having a patch on him that keeps the blood vessels dilated, and he was still having severe chest pain. So one of the staff stayed. We went on our outing. We came back. We prayed, Lord, please don't let him die while we're gone, because if the very first patient comes before we even open and he dies, he says that's going to be a terrible blot on our record. So he made it through the weekend, and Sunday we started a program. The only hydrotherapy that we could do, I couldn't do anything extreme, hot and cold, anything. I did shade to sunshine, and that's all they could tolerate. And then we drove him up to the cafeteria. We rolled him in a wheelchair into the building. You know, he just couldn't do anything. Amazingly, we prayed for him every day. Still severe chest pain, taking lots of pills to dilate the blood vessels. After 11 days, his pain quit miraculously. And the blood thickens with our food, and it takes a little time to get that thickening out of it. But his blood vessels were so tiny that only one blood cell at a time probably was going through. And as he got rid of his Vigilinks and his other oily foods from a vegetarian diet, but cheese and ice cream and everything else, then it started flowing smoothly with more water and no oil in the diet, and then his chest pain just miraculously quit. So he started walking 80 feet, then 150 feet, and 500 feet, and then we do the half-mile loop several times a day. On his last day, on day 27 or so, he said, I want to walk around the whole property. And I said, there's mountains, you know, I mean, it's steep. And he said, I want to do the 3-mile loop. And I go, I wonder if I have to carry him back. But we went ahead, we did the half-mile loop in the morning, and he did great. He said, no chest pain, I feel great. Checked his pulse, blood pressure was fine. After breakfast and a little rest time, we took off for a hike. And we did the 3-mile loop, no chest pain at all. He did fantastic. That evening we did 2 more rounds around the half-mile loop. He totaled 5 miles that day, and he was so excited. That's the beginning of his new life. And about 2 years later, I went to visit him in Palm Springs area, and he was still doing fine. He said, I have not had one chest pain since then. He showed me how he was doing his rowing machine and his treadmill, and he walks around his trailer park, and I mean, he was still doing excellent. So he was staying on the program. So, you know, God blesses us as we find these simple treatments and be real careful. Some people, you know, their bodies are adaptable enough still where they can fudge a little bit with 1 scoop of ice cream once in a while and a this or that, but this guy didn't have any way he could fudge any. So he was real careful, and it paid off. So God will bless us as we share this message with others. There's so many, but natural ways are God's ways. I want to have my wife to read a couple quotes to you, and then I'll go on to some other treatments that we're gonna share. So these are from Spirit of Prophecy, Ellen White's quotes. There's just 3 or 4 that are very helpful in showing us who's in charge, and that God wants us to be using these remedies. No, you ahead. That's all right. I'm close. She's a better reader than I am.
Disease never comes without a cause. That's Ministry of Healing 234. And then 5T 443 says, there are many ways of practicing the healing art, but there's only one way that heaven approves. God's remedies are the simple agencies of nature that will not tax or debilitate the system through their powerful properties. Pure air and water, cleanliness, a proper diet, purity of life, and a firm trust in God are remedies for the want of which thousands are dying. You want to say anything?
That's all right.
9164. When in faith the human agent does all he can do to combat disease using the simple methods of treatment that God has provided, his efforts will be blessed of God. That's a good one.
You know, one thing we try to do after we do our treatments is always ask that God will add his supernatural divine blessing upon the treatment. And he says that he will add an extra blessing above and beyond what just from the natural treatment. So be sure you pray.
9164. When the Israel of today humbles themselves before him and cleanses the soul temple of all defilement, he will hear their prayers in behalf of the sick and will bless in the use of his remedies for disease. And then Ministry of Healing 226. It's our work to present the sick and suffering to God in the arms of faith. We should teach them to believe in the great healer. Okay.
Thank you. All right. So God's ways are amazing. They're powerful. And he's given us simple treatments that are not taxing to the system. So everything we're going to be sharing today is going to be simple treatments. And God will bless you as you practice these things at home. All right. One thing that when we first went to Weimar, they used to mention that some studies were done on even with a microscope looking at little capillaries in the eye, talking about perfect circulation, and they could see that after a little bit of cream or a little bit of butter or some oil in the food that the blood cells started sticking together. They could see the blood slowing down. They call this rouleau formation. So that's another reason why on Bill Barclay's heart, he didn't have all that stickiness and the blood was getting through to oxygenate. Same thing in the brain with headaches, muscles aching, joints aching. We need to promote circulation. The best circulation is with simple natural diet. Okay. So how do we increase our circulation? We talked about doing good to others. That's one way. There's different water treatments that we can do. Hot foot baths equalize the circulation. If people have cold feet and that tends to cause different problems with circulation, even to the brain. Cool baths. It's amazing the benefits of a cool bath. And I'm going to read you a quote about that in a minute. But from even not being able to lactating after a mother gave birth to a baby 5-6 days and the milk doesn't come in. One of the ladies in Filipino lady that's teaching English down in Bangkok, she had a baby and she's so worried. She said, I've got to do something. My baby's not getting any food. It's been 5 days. I said, can you take a cold bath somehow? She said, we don't have a bathtub. I said, don't you have one of those containers that you do a pour bath, you know? I said, just get into that for 5 minutes and then hop out and do a friction rub. She said, I could do that. So she went, got into it, stayed for 5 minutes, started getting a little chilly, and I told her, stay until you start shaking just a tiny bit, you know, where you're a little bit uncomfortable, and then get out and dry off. And she says about 5 minutes. She said that night her milk just came in and the little baby couldn't drink it all. She said it was, yeah, she said it was amazing. Just simple little things. It influences the hormones in the mother. She was probably under stress and worried then if the milk didn't come in, she's under more stress because the baby's not getting the nutrients. And this just kind of erases the board like a whiteboard eraser and makes everything tonic. It's a tonic treatment that stimulates all the glands, including, and I told her to put her head under too, because we need the pituitary, pineal, and just to stimulate everything. Just go under, back up, under, back up. And she did it, and it was miraculous. And it can happen for lots of different things.
So
It was done in Thailand.
If you, I don't know, but
Anybody. And for those,
do
you know,
have
you,
to take ice and put into it if,
No, it was-
if the water's not cold?
It could
It's-
just be river water.
river water, yeah.
River water temperature, like the Korean is basically.
I like what you said. Simple treatments that do not tax the system.
Yes.
It doesn't have to be super, this needs to be enough.
Not, doesn't need to be high tech or anything.
Yeah.
Later on, we're going to show you another treatment that's a steam bath using the sun, and then a cool bath afterwards. Just different things that relieve pain.
For depression recovery, though, Dr. Nedley has them do it twice a day, a hot water bath and then ice bath, back and forth.
Yeah.
They're actually in ice, where they pour it over
Cool.
themselves for about 2 minutes and then they go back to the hot. Twice
They're
a
using
day.
a steam bath and back and forth. The very first patient that Dr. Nedley experienced, one of his early depression groups, this one lady had really, really bad depression. She would not join in with the group for anything. For about 3 days, she said, no, I feel horrible. I'm not going out with all those people. So one day they said, you've got to do something. We've got a treatment for you to do. And they had a jacuzzi, and they had a cold pool right next to it. So they put her in the jacuzzi for 3 or 4 or 5 minutes to warm her up, and then they put her in the cold pool for 30 seconds, and then put her back in the hot, and then put her back in the cold for 45, 50 seconds, and then they put her back in the hot, and then in the cold. And then when she got done, she said, you know, I feel a lot better. Where's the rest of the group right now? She said, well, they're out taking a walk. Can we catch them? And the guy about passed out. Like, yeah, we'll go find them. And so they went out there and they found the rest of the group. They walked the rest of the way. They came back and said, what did you do to this lady? He said, and they told him, we did hot and cold baths. He said, well, we want to do it too. And so that was the beginning of his hot and cold treatment because of that one lady. Maxine.
The same baths, but sometimes here, because the students they only have their showers.
Yes.
I tell them to do the hot and cold shower, get their head involved as well.
Yes.
I know it's not as effective, but is that, and of course we have water shortage, so that's when the cycles are shorter, but something better than nothing, right?
Yes, yes.
Hot shower as hot as they can, and cold, and alternate.
Yeah.
He's going to show you something later.
And I think I'm going to describe it right now, just because it fits in nicely. When we were in Burma, right on the border with the Korean people, on the way over, I was thinking about how can we do a steam bath for these people out in the jungle. I mean, they don't have electricity to make steam. They make a fire and make a little steam. It's going to burn something, or they'll be close to the fire and I smoke. And I said, I wonder if we could use the sun. And I mentioned it to somebody. They said, you know, the Indians will wrap some patients with banana leaves and put them in the sun. So I said, I think we could do that. So I bought a sheet of green plastic to pretend that it was banana leaves. And so I took it up. I bought it in mess out, and we took it up. And the first time we hadn't even cut it. We took 2 people end to end, so their feet were touching, and to practice to see what it would do. And we put a sheet down, rolled the sheet around the person, and actually I was the patient on one end and one of the students was on the other end, and we took our temperatures. We wrapped it in the sunshine, and in about 20 minutes my temperature went to 102. I mean, that's significant. That's fever therapy. That's what we want to do. And by another 5 minutes, 103. And so then I got out and I went and jumped in the river there, and we were keeping our foreheads cold, you know, with cold water. We didn't have ice, but we just kept dipping it and covering your face, you know, covering your eyes because you're looking right at the sun. But it got real hot and sweaty in there, and I mean, it was just amazing. It's a great sauna. And so I've also done this with trash bags, where there's a black trash bag on the bottom, and I punch a hole in the top, and I pull the top over me. And I've done it in Bangkok when I was feeling like a cold was coming on. So, and then I get out and go take a cold shower. So it doesn't take too long, but to jump into the cold water up there in the jungle, that made me feel so amazingly good. I mean, I was like transformed. I felt like Superman. I started building a dam right through the river, picking up boulders and and moving them and picking it up and made a little boulder dam to make this a little deeper spot. So at the same time, we had this monk that came down out of the mountains 5 kilometers. Somebody had to carry him. This was up at the Tidwell's place on the other side in Burma, on the Karen side, across the river. And so this monk had come down. He had his orange robe on, and this little short guy with big muscles, tattooed all over, carried him down 5 kilometers, and on his back. So they dropped him off, and Lila and Dennis started giving him different medicines. He had chronic malaria. Back in the 80s, yeah. He had chronic malaria, and his back pain and his chest pain was the thing that was bothering him the most. Mostly back pain. He said it was just killing him. I tried doing fomentations to his back, chest fomentations, massage. I did everything I could think of, and it wasn't touching his pain. They started giving him medicine for his malaria, and it still wasn't doing anything. So Thursday night, we were going to leave Friday morning, and so I said, why don't we try and we now call this a burrito wrap, because you look like you're in a burrito, the solar burrito wrap.
So you put a sheet?
So yeah, I put the plastic down first on the ground, then I put a sheet down.
Is the sheet wet or not?
No.
Okay.
And then we wrap the sheet around them, and you want to be sure you got 2 layers of the sheet over top of their knees and chest, because one time we did it over at the health center here, and one of the patients had really too hot on her breast and on her knees, and apparently it was just one thickness in it. And so you could take a small towel, put over any place that's on the toes that's sensitive and just bony too, because but so we did cold packs on her, and she was fine after that. But I was a little concerned that she might have a little more than just a sunburn. So anyway, this monk, we decided we were going to try it on him on Friday morning. Well, we left to go on our hike, and I left it with the new students that we had just trained how to do it, and they treated him with this. So we hiked up the mountain to his village and to his temple. We had just gotten there, and we see this monk coming up the stairs. And he said, "Hey, I feel great." And I went, "You walked all the way up here?" "Yeah." He said, "I feel terrific." He said, "What happened?" See, we did the burrito wrap in the sun, and as soon as I jumped in the river, my pain went away, just totally disappeared. I said, "Now that is amazing. That's a miracle." He said, "I'm telling all my village to come down to that clinic anytime they've got health problems." That's amazing.
So you basically.
The students had wrapped him up, put him in the sun for 20-25 minutes, and then unrolled him, took him down to the river, which is just 2 minutes away, and he jumped in the river. He said as soon as he got in that water, his pain disappeared. Yeah. Well, not a deep water. This was cold water too. It was a nice contrast. It felt so good. So, if you don't have a stream, you can use a bucket of cold water and just dip it over you. Just whatever you've got, use something cool. But if you got some extra ice, cool it down a little extra. But
I was just thinking, because my natural remedies class, now it's like take it up a notch for them to do wherever they go. Just get if you've got one of those big things, you can just step into that and pour water in that, and then just kind of dip in and come out.
yes, get down as far as you can, and then take one of those little dippers and just keep pouring it over you. Steve Bassam, years ago, he had Parkinson's disease, and one of his treatments, he did like 5 things every morning. Natural treatments, but he's still alive today. This has been 39 years ago that he was diagnosed with Parkinson's. There's not a single Parkinson's patient that's lived that long. He's outlived them all. He was our mission president here. So he'd get up in the morning at 5 o'clock. He would do a steam bath to begin with. Then he would sit in a cold basin of water like you're talking about with ice floating in it and pour it over his head for 5 minutes. Now that's stimulating his pituitary gland, his pineal gland, all of his glands, his hypothalamus, his adrenal. He's sitting in the water and pouring it over himself. And then he would.
Ice water 5 minutes.
5 minutes, yeah. I mean, it's regular water that's got ice floating, so it's melting. So it's not 37 degrees. It's probably 50 degrees or 55 degrees. In fact, what I've read is that the benefits of cold water are not really any more benefits below 55 degrees. So if you can just don't try and make it freezing cold and hurt people. You just need to stimulate them, and 55 degrees is very stimulating if you ever tried that. So he did that. Then he dried off, and he had a maid, and his maid gave him a full body massage. And then he did some trampoline jumping because he can't walk real well. He wanted to increase his circulation, so he's on a small little mini tramp, and he's jumping up and down. Then he went, and then every day, I think 3 times a day, he would take like 3 or 4 capsules of cayenne pepper. He said the cayenne pepper just dilates his blood vessels, gets his circulation going, and so he tried to do that. This man could not even talk if he did not do that. So he could not drive, Parkinson's. He could not walk at all. So after doing this every day, he could... Yeah, well, I'm maybe exaggerating slightly. It might have been 1 tablet 3 times a day or something like that. But I'll have to check with him again. But I know he took some cayenne pepper, and he took it in capsule form because it burns going down. So he'd get it in his stomach, and it would kind of release, and it would help him to feel better. So after he would do this, then he could go and he could do his morning worship at the church or at the mission. He would be in charge of the meetings. He was the chairperson. He was the mission president. He would drive to different provinces and do weeks of prayer, but he'd have to do this routine every single morning or he couldn't function. By about 3 o'clock in the afternoon, he had to come home to his room and just rest the rest of the time, eat a little something and go to bed. Get up at 5 o'clock and start the whole routine over again. Maxine.
You shared that with me, the cold shower part.
Yeah.
When I was here in HPC, and my whole practice as a physiotherapist, every Parkinson's patient I had, I didn't have all the details, but I said, take a cold shower, let the water run on your head.
Yeah.
Do that every morning, and you'll buy yourself some good time for the day. I don't know how many of my patients did it, but I told every Parkinson's patient
good.
to do it. We had a pastor who was the president of the South England Conference. He didn't work very long when his Parkinson's just took up. I told him that now that he can mess with his details, I will tell him the additional stuff because he's out of commission. Because it's not medicine, and people are so reluctant to follow the advice. Yeah. If you get the protocol, then it would be really nice so I can.
So after about maybe 10 or 15 years of being mission president, he said, it's time for me to retire. So he went to the doctor and he said, doctor, he said, I need 100% disability so I can retire. And he goes, Steve, I can't do that. You're not disabled. He said, I'll be back tomorrow. And so the next day he came in a wheelchair. And the doctor said, Steve, what's up? Why are you in a wheelchair? He goes, and he couldn't even talk. He said, stand up, Steve. He tried to stand up. And he couldn't take a step. He couldn't initiate a step. And he goes, sit down, Steve. 100% disabled. Because if he did not do that every day, he was a mess. He was physically unable. And this routine stimulated his system and his hormones to release. That's the power of hydrotherapy, hormones, exercise, just as an illustration of somebody that's really sick. It didn't cure it, but it got rid of his symptoms for 6 or 7 hours so he could work. Miraculous. So think about that when you've got your patients, your friends, sometimes it's just small little things. They have a mild headache or something like that. Think of simple things like singing out of doors under the trees. Just out of the box kinds of things. Mike?
It occurs to me that God may allow some of these things because he's using someone so powerfully, but to help them to stay humble, they have to be completely dependent on God on a regular basis.
Yeah. Paul said he asked multiple times, 3 times over, he begged God to cure him of whatever problem he had, and we're pretty sure it was something to do with his eyesight. Because other place he said, I'm writing these big letters, and because I can't really see it too well, and so I'm pretty sure it was eyesight. But God said, no, you need this. You need this ailment to keep you humble, and we often have that problem. My wife has a lot of ailments from time to time, stiff neck and whatever. She is one of my favorite patients to work on. She's given me a lot of insights into other things that I can help other patients with. Sometimes I have problems of my own. We'll talk a little bit more about neck pain, but one of the things that I've had for about 2 months was this tinnitus in my ear, so that there was this ringing in my ear that was like a ship coming in. It was always the same exact tone. It was boop, 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 and it was just annoying. It was like, would you please come into the harbor and turn that thing off? But it wouldn't do it. It was like 3 months. I'd go to sleep and I'd hear the ship boop, boop, and it was really a pain. It was always in this right ear. So I made an appointment to see the doctor about my ear, and that morning I was having my devotionals. I still remember there in Tennessee reading my Bible. I said, I haven't massaged my neck to see if I've got some tight muscles there. I wonder if I really dig in there deeply, if I could massage that and get rid of it. So I still read my Bible, and I'm just, wow, that's really sore there. Man, so I just worked on it, and I pressed on it and dug around on it, and then all of a sudden, boop, no more sound. And I was like, I wonder how long that's going to last. The rest of the day it was fine. I went to my doctor's appointment for my ear, and I said, Doc, I'm really sorry. I cured it this morning. And he said, what happened? I said, this has been bothering me 3 months, and I did some deep massage on my neck, and this sound went away. And he said, well, we'll go ahead and check your ears. Everything was perfect. He said, thank you for coming in. He said, I'm going to send all my patients to therapy now and get them work on the neck, because it's a very difficult thing to get rid of. So sometimes we have these ailments to teach us to be a blessing to others. So for Steve Bassam, his Parkinson's has helped many people to know how to do, even if it's not Parkinson's, it may be some other disease that needs stimulation, similar to the depression patients. That routine would help a depressed patient too. You just need to stimulate all those hormones to work. Okay? So let's take a 2-minute break, and then we'll have you stand up and do a little exercise and stretch, because we all need to keep moving.